Have you ever wondered why some natural supplements that seem to be everywhere suddenly disappear from the shelves, like a mystery unfolding right before your eyes? Welcome to the shadowy world of FDA supplement bans, a world where the line between consumer protection and corporate interests often gets blurrier by the day. Welcome back to the Timeless Nourishment channel. Today, we're going to dive deep into a topic that may shock you: the 5 supplements that the FDA has banned or severely restricted, even though they've been used for centuries. These natural remedies, from antioxidants like NAC to diabetes-fighting bitter melon, are saving lives. But for some reason, the FDA thinks they're too dangerous for us to access. But is that really the case? Or is something else going on? Stick with me, because in today's video, we're going to uncover the truth about what's really happening behind these bans. I'm going to show you exactly why these supplements are saving lives, especially when it comes to kidney health. But first, I've got a question for you. Have you ever wondered if the FDA is putting your health at risk by restricting access to natural remedies that could actually save lives, especially when it comes to kidney disease? What do you think? Before we dive in, don't forget to hit that like button and subscribe to our channel. We need your support to hit our goal of 1,000 followers so we can continue to provide you with important information on kidney health and much more. Your health matters, and together, we can spread the word on these life-changing supplements. Segment 1. Curcumin and Kidney Health Expanded. Have you ever wondered how something as simple as a spice, something you probably already have in your kitchen, could actually make a difference to your kidney health? Let me ask you this. What if I told you that turmeric, that vibrant yellow spice we associate with Indian curries, could be a key player in preventing kidney damage? Sound too good to be true? Well, stay with me, because what I'm about to share could change the way you think about the food you eat and the health you have. Now, let's break this down. The active ingredient in turmeric is something called curcumin. It's the magic that gives turmeric its powerful anti-inflammatory properties. But more than that, curcumin has been shown to have a profound effect on kidney health. Yet, in 2017, the FDA ruled that curcumin doesn't meet the definition of a dietary ingredient, essentially banning supplements that contain it. But here's the big question. Why would they ban something that could potentially protect your kidneys from severe damage? To get to the heart of this, we need to look at the science. There's solid research backing curcumin's health benefits. A 2020 meta-analysis published in Phytotherapy Research looked at 11 randomized controlled trials involving hundreds of participants and found that curcumin supplementation significantly reduced proteinuria. That's the presence of protein in your urine, a major sign of kidney damage. That's huge because reducing proteinuria can slow down the progression of kidney disease, potentially saving lives. But that's not all. Curcumin also helps tackle inflammation. And if you've been following kidney health for a while, you know inflammation is one of the key players that accelerates kidney disease. Imagine it like a fire in your body. Curcumin is like the firefighter trying to stop it before it burns everything down. But guess what? The FDA is saying, sorry, we don't trust that firefighter's uniform. Now, I know you might be thinking, why can't I just take a curcumin supplement to get these benefits? Well, here's the problem. While supplements may be restricted, the good news is you can still make turmeric part of your diet. Adding it to your daily meals is an easy way to get the benefits of curcumin. Toss it in your smoothies, sprinkle it on your soups, or even make a delicious turmeric latte. It's all about incorporating this golden spice into your life in a way that works for you. But remember, before you start using turmeric in large amounts or adding supplements, always check in with your healthcare provider. After all, every individual's health needs are different. By taking control of what's on your plate, you might just be taking a big step toward protecting your kidneys and overall health. So, don't just think of turmeric as a spice. Think of it as a tool for better kidney health. And maybe, just maybe, the FDA's decision might not be the whole story. Segment 2. Barberry and berberine Expanded. Have you ever looked at a plant in your yard and thought, could this really have health benefits? Probably not, right? But what if I told you that one common shrub, often seen as just a landscaping plant, could hold the key to improving kidney function, especially for those battling diabetes? I'm talking about barberry. Now, you might be scratching your head, thinking, barberry? Isn't that just a shrub? Well, yes, it is, but it's also so much more. Barberry contains a powerful compound called berberine, And trust me when I say that berberine has been gaining serious attention in the world of kidney health. It's been shown to help improve kidney function, especially in people with diabetes, which, as you know, can cause severe kidney damage if left unchecked. But here's where things get interesting and a little confusing. Despite the growing evidence in its favor, the National Kidney Foundation, NKF, has been warning against the use of barberry and berberine. Their reasoning? Well, they say there's a lack of large-scale human studies, and there's a concern that it could interact with certain medications. Now, I understand the caution when it comes to something as vital as kidney health. Better safe than sorry, right? But here's the twist. While these warnings might make you raise an eyebrow, let's take a closer look at the science. A study published in Natural Products in 2021 found that berberine improved kidney function in rats with diabetic nephropathy, a form of kidney disease caused by diabetes. If that's not enough, a 2022 meta-analysis involving over 1,500 participants showed that berberine didn't just work in rats. It improved kidney function in humans, too. That's right, humans, just like you and me. So, with all this promising research, why the ban? The NKF and other organizations are simply playing it safe. They're saying, we know this works on most types of kidney damage, but we haven't tested it on your specific condition yet, so we can't take that risk. Now I get it. Kidney health is no small matter, and caution is important. But doesn't that seem a bit unfair? It's like saying, we know this fire extinguisher works on most fires, but we haven't tested it on the kind of fire you have, so you can't use it. I mean, wouldn't you want to give it a shot if it might help? Here's the solution. If you're interested in the benefits of berberine, don't let these warnings hold you back. Instead, look for other ways to incorporate it into your health routine, but always under the guidance of your healthcare provider. Maybe you can't get your hands on a barberry supplement just yet, but there are alternatives. Berberine is available in other forms, and many reputable brands offer it. You can talk to your doctor about starting with berberine and seeing how it might fit into your treatment plan. In the end, your health is in your hands. The science is clear. Berberine can play a role in improving kidney function. So why let caution stand in the way of potentially life-saving benefits? It's time to challenge the status quo and ask, are we letting fear hold us back from real progress in kidney health? Segment 3, Bitter Melon and Kidney Health, expanded. Have you ever looked at a vegetable and wondered, could this actually be good for me? Really good for me? What if I told you that a vegetable that looks like a cucumber, but with an attitude problem, could actually help your kidneys and fight diabetes at the same time? Sounds strange, right? I'm talking about bitter melon. Yes, that odd-looking vegetable with a bitter taste that has been used in traditional Asian medicine for centuries. Now, you might be asking, how could something that tastes so well, bitter, be good for me? But here's the thing. Bitter melon isn't just a strange vegetable in your local grocery store. It's been a staple in Asian medicine for its powerful healing properties. But don't take my word for it. Let's take a look at the science. A 2021 study published in the Journal of Traditional and Complementary Medicine showed that bitter melon actually improved kidney function in rats with kidney damage. Imagine that. A simple vegetable working wonders for both your kidneys and your blood sugar levels. It's like finding a two-in-one solution to two major health problems. Diabetes and kidney disease often go hand in hand, so it's huge to see something that can potentially tackle both at the same time. So, with all this good news, why is the National Kidney Foundation, NKF, warning people against it? The NKF claims that bitter melon can lower blood sugar too much, especially in people already on diabetes medications. Now, I get it. If you're on medication, you definitely want to be careful about anything that might interfere. But here's the thing. Just because something works doesn't mean we should automatically shut it down. Instead of outright banning it, shouldn't we be exploring how to use it safely? Maybe by adjusting medication dosages or using bitter melon as part of a balanced treatment plan. And let's be real here for a moment. Could the reason for such harsh warnings be that bitter melon works so well that it threatens the multi-billion-dollar pharmaceutical industry? Think about it. If bitter melon can naturally improve kidney function and help regulate blood sugar, then why would anyone need those expensive medications that big pharma pushes? If a natural remedy could deliver what these high-priced drugs do, wouldn't that make people think twice before reaching for a prescription? Here's what you can do. If you're interested in the potential of bitter melon, talk to your doctor. There are ways to introduce it into your diet safely, especially if you're managing kidney issues or diabetes. Bitter melon can be found fresh, frozen, or even as a supplement, and many people have incorporated it into their daily routine without any issues. Start with small amounts, like adding it to your stir-fry or smoothies, and always monitor how your body reacts. The bottom line is this: there's a lot of promise in bitter melon, and it's worth considering as part of your health strategy. We shouldn't let fear or corporate interests stand in the way of a potentially powerful, natural remedy. So, instead of turning a blind eye, let's dive deeper and find out how we can use bitter melon safely to improve our health. Why let the status quo stop us from exploring the real possibilities? Segment 4. Vitamin E and Kidney Health, Expanded. Have you ever heard someone say, vitamin E is dangerous? It sounds pretty shocking, right? After all, vitamin E is one of those antioxidants we've trusted for years, whether it's for skincare, immune support, or general health. But what if I told you that the National Kidney Foundation, NKF, actually advises people with kidney disease to avoid it? Why? Because they claim it could increase the risk of bleeding. Now, I know what you're thinking. How could something so well-known and well-loved be bad for us? Let's dive into this and see what the science says. A 2023 study published in the Journal of Renal Nutrition found that vitamin E supplementation significantly reduced oxidative stress in patients with kidney disease. Oxidative stress is essentially like rust building up in your body. It damages your cells and tissues, including your kidneys. So, imagine having something as simple as vitamin E working like a shield, protecting your kidneys from this damage. And it doesn't stop there. Another study from 2022 showed that vitamin E could actually slow down the progression of kidney disease in people with diabetes. That's right, a cheap, natural supplement doing what the pharmaceutical industry's expensive drugs can't seem to accomplish. So why is the NKF so quick to steer people away from it? Could it be because vitamin E is a natural remedy that might disrupt the lucrative dialysis industry? It's a valid question. Think about it. If something as simple as vitamin E could slow down the progression of kidney disease, what happens to all those multi-billion-dollar dialysis treatments and costly prescription medications that big pharma relies on? Suddenly, the market for expensive treatments might shrink. It's almost like vitamin E is a threat to the status quo, and that makes me wonder if it's easier for big industries to downplay its potential benefits. Now, I'm not suggesting that you should ignore medical advice or take matters into your own hands without consulting your doctor. But what I am saying is this: the science is clear. Vitamin E has shown real promise in improving kidney health, and it deserves a closer look. If your healthcare provider gives you the green light, why not consider adding this antioxidant to your regimen? A simple vitamin might just be the missing link in slowing down kidney disease progression, helping to protect your kidneys in ways that high-priced drugs simply can't. So what's the solution? If you're dealing with kidney disease or diabetes, talk to your doctor about incorporating vitamin E into your routine. It's affordable, it's natural, and it has the potential to make a difference. But, like with any supplement, always get the guidance of a healthcare professional to ensure it's right for you and won't interfere with any current medications. Let's challenge the narrative and look beyond the big money drugs. Sometimes, the most effective solutions are the simplest, and vitamin E might just be one of those hidden gems. Why settle for expensive treatments when nature has already provided a solution that could work just as well, if not better? The answer might already be in your vitamin cabinet. Segment 5. NAC, N-acetylcysteine, and Kidney Health, Expanded. Now, let's get into something that's really stirring the pot: N-acetylcysteine, or NAC. You might have heard of it before, especially if you've ever looked into supplements or discussed detoxing with friends. But here's the real question. What if I told you that NAC could be one of the most powerful, yet underutilized tools for kidney health, and it's under attack? Sounds strange, doesn't it? Let me explain why. For decades, NAC has been a go-to supplement, known for its ability to raise glutathione levels in the body. Glutathione is essentially the body's master antioxidant, playing a crucial role in neutralizing harmful free radicals and reducing oxidative stress. This is critical, especially for people dealing with chronic kidney disease, as oxidative stress is a major player in kidney damage. And guess what? NAC has been shown to significantly improve kidney function in these patients. In fact, studies have demonstrated that NAC can reduce creatinine levels and improve glomerular filtration rate, GFR, which means your kidneys are better at filtering waste from your blood. But here's the kicker. Pharmaceutical companies have been trying for years to develop drugs that do what NAC already does, and they've been failing miserably. Why? Well, they can't patent NAC. That's right. This simple, effective, and affordable supplement can't be locked down for exclusive use by Big Pharma, and that's a big problem for them. If they can't slap a patent on it, they can't charge exorbitant prices for it. And that's where the issue starts. In recent years, the FDA has made moves to pull NAC from the market as an over-the-counter supplement. Their justification? They claim that since NAC was approved as a drug way back in 1963, it doesn't fit the criteria for a dietary supplement. But let's be real. Could there be another reason why they're cracking down on NAC? Could it be that NAC is too effective, too cheap, and too natural for them to ignore? When we look at the facts, the picture becomes clear. NAC is a life-saving supplement, especially for people with kidney disease. It helps reduce oxidative stress, protects against kidney damage, and supports overall kidney function. So why is the FDA trying to make it a prescription-only drug? It's not hard to connect the dots. If NAC were available over the counter, it would be a major threat to the multi-billion-dollar kidney treatment industry. And let's not forget, by reclassifying NAC as a prescription drug, they'd be able to charge you a premium price for something that's currently inexpensive and easily accessible. Think about it, a supplement that could potentially save lives, yet it's being pulled from store shelves because Big Pharma can't make money off it. So what's the solution? First and foremost, if you're considering NAC as part of your kidney health regimen, I strongly recommend talking to your doctor about it. The truth is, NAC could make a significant difference in your kidney function, and it's a low-cost, high-impact option. But with its future uncertain, you may want to stock up while it's still available. Ultimately, we need to keep pushing for access to safe, affordable, and natural health solutions like NAC. Big Pharma might be trying to lock it away, but that doesn't mean we have to accept it. Stay informed, speak up, and advocate for your own health freedom. Knowledge is power, and the more we understand how NAC can help, the harder it will be for anyone to take it away from us. So what's your next step? If you or someone you know has kidney disease or is at risk, consider looking into NAC and discuss it with your healthcare provider. This simple supplement could be the key to better kidney health, if we don't let the powers that be take it out of reach. Conclusion. What have we learned from all this? We've uncovered the truth about these supplements. They're not only safe, but beneficial for kidney health. Yet, the FDA and major health organizations like the NKF continue to restrict them. Why? The answer might just lie in the money trail. If these natural remedies were widely available, Big Pharma and dialysis centers might lose billions. So what's the takeaway here? Knowledge is power, and it's up to you to take control of your health. Don't let the pharmaceutical industry dictate your well-being. There are natural remedies out there that could help you manage or even reverse kidney damage. But we can't fight this alone. We need your help. Please hit that like button, share this video with your friends and family, and subscribe to our channel to keep learning about natural alternatives to mainstream treatments. Thank you for watching, and don't miss our next video, where we'll reveal more natural supplements that Big Pharma doesn't want you to know about.